Okay, it's time for us to talk nutrition, and to do justice to that is Osunsanya Olajumoke, a registered dietitian, nurse, and also a master of public health. She has over 6 years clinical experience. She graduated from the University of Agriculture, Abeokuta, in 2012. After 4 years of studying nutrition and dietetics, which is a comprehensive study of nutrition and science and diet therapy. She also holds a master's degree in public health nutrition from the University of Ibadan. She will be talking about myths about breastfeeding, but I think instead of that, we'll talk about picky eating instead. So let's focus on picky eating.
Yes.
Yeah. So when we talk about picky eating, it's actually broad,
Yeah.
especially for me, because when I hear picky eating, I'm like, okay, maybe the person just doesn't like the food, or it could be a case of the person probably doesn't even like food at all. So there are actually different angles to it. But you're the expert. Tell us what picky eating actually is.
Oh, well, picky eating, general definition, is when a child is fussy and refusing food, or the child can actually take some part of the food, maybe small part, and refuse the rest. And it's usually happen between 9 months and 3 years. When the child starts to show you that I'm independent, I can choose. I can choose. I can choose to close my eyes. You can move your head away and say, I don't want that.
Food at
exactly. All. So that is when picky eating becomes prominent. But you can actually start from any age, from 6 months, but much more between 9 months and 3 years.
Okay, so that's usually the cause when you pick some things.
Basically, when you just eat small or you refuse it totally, you know, and if it is not properly handled and managed, can lead to, you know, drastic weight loss, and of course, compromise the immune system.
Now, you said between 9 months and 3 years mostly, right?
Yes,
but there are children who continue it even into their teenage years.
That is when it's not properly managed between about 9 months and 3 years. It will, of course, go on, you know, uncontrolled. It will not go away. Okay. Some will go away. Okay. You know, the child will outgrow it. Yeah. In some cases, the child will not outgrow it, and it will, you know, to go on to teenage years and may cause some developmental delay.
I can tell you that many parents going through that, especially those whose children are probably like 8 years or 9 years old, are like, okay, how can we put a stop to this? But before we talk about how it will be managed, let's even talk about the causes. What leads to it exactly?
All right, the causes, I'll first talk about the myth around it before I now talk about, that is what does not cause it, and then the cause of it. And the myth around it, some people have this idea that once a child is exclusively breastfed, the child will automatically turn picky eater. You know, that sounds logical because you might be thinking, oh, the child has known breast for 6 months, unlike a formula-fed baby that is already used to cup, already used to bottle, you know. So it's actually logical for you to think when the child stops breastfeeding that the child may not embrace home foods. But that is actually not true, because both formula-fed babies and breastfed babies have equal opportunities. They show the same readiness towards food.
You know, I can even agree with you, because my little nephew was he's 5 months plus now, and he was able to taste stew, just a bit of it, and he's on exclusive, and he just went, this is what I've been enjoying. And then since then his mom has been struggling to keep him away from food, so she's just waiting for him to be 6 months.
My own child started looking at me from the age of 4 months, looking and looking, but I told myself, I'm going to
make this 6 months.
Exactly, you stay 6 months before I introduce you to any home
My
food.
sister literally holds everybody to ransom. Don't give him, because he's really interested. You're eating and he's following your food.
Exactly, showing that readiness. Both formula-fed babies and exclusive breastfed babies show that, so they have an equal start. They have a fair chance to start together. You understand? So basically, it is not about being exclusively breastfed or not. You know, another thing, myth around it is when a child refuses your food, it means that the child does not like the food. That is not true. The child might be trying to get to like the food. The child is used to breastfeeding, and all of a sudden you're giving the child something new. I used to use this example that if you are to go to Ghana and they give you their special delicacy, it's special to them, but when it's getting to your mouth, it's your adulthood that will make you swallow the first spoon and say, I think I'm okay, you know. But a child does not know how to hide it, so the child will spit it out you know, but may try out.
I don't want any of that.
May try that another time,
Yeah.
you know. So basically, it's not about the child not liking your food. It's the child trying to get used to the food. So those are the basic myths of it.
This second one is very important,
you know,
because
very, very
immediately an average child decides, I don't want this. Many parents just take it out from the diet, believing that, oh, the child doesn't like it. So it's important you mentioned that. Thank you.
And another thing is that some mothers actually think picky eating is restricted to certain children, that some children don't ever have it. But that is not true. If your child is sick, your child is going to be picky, you know, just that period, you know. So every child has a picky eating phase. There will be a time when the child will refuse your food. It's not every time that your child is going to accept all your food.
You know what? We're going to jump several audios now and then talk about solutions.
Causes.
No, let's go straight to solutions.
Straight to solutions.
Now. Like, how can we fix it? Especially for people whose children are way past the 3 years old mark.
Well, I would say that fixing starts from when you start complementary feeding. A lot of research studies have actually shown that inappropriate complementary feeding, starting complementary feeding, can result to picky eating later. So the start is from the foundation. You have to start complementary feeding appropriately. Prepare for complementary feeding. Most people, we women were prepared for breastfeeding. Our body adjusts, our breast enlarge. You know that you're supposed to breastfeed. But when it comes to complementary feeding, you just think you can just walk into the supermarket and get the best baby food, and then you start the baby on that. That is not good. You're supposed to actually allow the child to explore diverse foods and explore different textures. That's very, very, very important. And another misconception is your baby is going to just take every food, either it is palatable or not. You must know how to combine foods to provide all the nutrients. If the food is not palatable, your child is not going to take it. And of course, like I already said, allow the child to get used to the taste of food. Where patience comes in, you have to be patient. Most of we mothers, we don't really have the time. We don't have the time to study our children, to check the trend. Okay, she does not like this. Okay, she likes this. Okay, she likes this food this way. Okay, she likes that food that way. You have to be able to observe, and it's a lot of work.
And an average person is looking, oh my God, looking at the 6-month-old and like, wow, where do I start?
It's a lot of work.
You know what? I know this is a very broad subject.
Very broad.
It looks like something that we should not have decided to talk about in just 1 week. But I really must thank you for your time. Thank you so much. I've learned a lot today.
You're welcome.
We'll take this break and then we'll be right back because we have more for you on Wake Up Nigeria.